This video discusses in detail the condition of the hand function use for this quadriplegic boy of 3.5 years of age before the start of ABR. We'll use this video to demonstrate and explain the key essential components which are not only specific for this particular child, but the ones which are very much universal for a dominant majority of the kids with spastic quadriplegic cases, the ones who are unable to use their arms for any meaningful hand function. And that's his case. You see, to start with, he's pretty much incapacitated. He doesn't really do anything and he can't really use his arms for any grab or any purposeful movement or anything like it. So his mother breastfeeds him because he's unable to hold the bottle, and most of the time he spends on her lap. She carries him around all the time, and actually he's not very comfortable when being left alone in any position. So let's get to the details and nuances. So what we are seeing as he tries to move the arms, that's pretty much all that he can do. Actually, this is not really the move of the arm. What he does, he basically pulls his body forwards, unable to complete the move, the arms go up, and then within this move he is still able to have certain room for the arm positioning, and then after that he just drops backwards. Well, I believe it's quite important and interesting to understand several things. Where does this limitation come from? Because the analysis or the answer to this question would define what we are actually doing with this child. And this is the central thing. The classic approach that most of the parents try to follow is based upon the idea of training for hand function. So basically the logic is quite simple. If the child does not have the proper hand function, let's try to encourage him to use the arms, and then maybe through this the function would improve. Well, at first that sounds like a logical proposition, but the results, they don't really back up this understanding and this strategy. And again, this boy, this case is a demonstration, because he had 3.5 years of rehabilitation. As I already mentioned, his mother, she is a pediatric doctor herself. She's well educated in this particular field. She's very dedicated, hardworking. So his lack of function at the age of 3.5 years was not for the lack of trying. Well, let's have a look. So you see, obviously, what is this? This is lack of segmentation. I'm trying to move this boy by the head. What happens to the arms? The arms are rigidly stuck, right? We can call it this W position. And we will see that this W position is not only present when he is being moved by the head. This W position is characteristic for him all the way, right? When he's just supine in a relatively relaxed way. Again, it's the same W position. What does it mean? That means that he cannot put his arms further down. That means that he cannot bring them closer to the body. And obviously, that means that he is unable to have any selective hand function. And you can clearly see that the more challenging is the environment, like for instance sitting here for him, the more pronounced is this W shift of the arms. And once again, I repeat this thing. With this, it is impossible to get them moving downwards. It's impossible to have a meaningful hand function. Let's have a look once again on what he's trying to do. You see, as I move the head forwards and backwards, you see the arms, they move in counter direction. So this is not a voluntary response. This is the automatic, spontaneous reaction. And when we are getting back to the analysis of the free hand motion, well, that's all that we can see. Now, let's have a look at the basis behind it. We want to disclose and kind of try to understand what's behind this strange W position of the arm that prevents him from any hand use. And that's where this view is very helpful for us. Please have a look. What we are seeing that the distance between the base of the skull and the shoulders is absolutely minimal. They are pretty much conflicting with each other. The arm is the entire shoulder girdle, both arms, they are above the neck. They have sort of slipped, shifted all the way upwards. And that's the reason why the arms are being so high above. That's what you see. It's an easy understanding. Basically, empty, weak neck, slide of the shoulders upwards, and these are the arms which are being locked above. Another important thing that we can see here is really interesting. This is what you're seeing here. The depression of the shoulder blade sinking all the way into his back. So we're seeing double challenge. Slide of the shoulder blade all the way up through the neck, and depression of the shoulder blade into his back. And once we figure this out, it's easy to understand that these weaknesses are the things which are behind this W position. So you see, once we zoom in and start looking in a little bit more detailed way, instantly we can figure things out. And again, what I'm showing here is not some rocket science. I haven't mentioned anything about some mysterious signals coming from the brain or whatever. I have just pointed out a very simple thing: the weakness of the neck that causes the slide of the shoulders and respective weakness of the back. And of course, together with this, we also have the weakness of the shoulder joint capsule, right? And then if we look further, you can see this. As the head is being moved forward, you see how the ribs are protruding outwards, right? And again, all this demonstrates very clearly what we're observing, the weakness along the center of the chest. So this way, we're bringing you back to the simple understanding. There are plenty of weaknesses. And when most of the dominant majority of the existent training or existent rehabilitation approaches follow two avenues. One avenue is training, like trying to impose the function instantly over this poor structural basis, over absent weight bearing, over absent segmentation. Whilst the other schools, they try to force the segmentation by trying to concentrate on the release of the tight muscular groups. Well, we are bringing a completely different focus. We're saying that, well, let's leave this poor boy alone. He's weak. Let's not try to force him, because of course, upon closer inspection, these muscles of the neck, they would be tight and rigid. But our focus is different. Underneath this rigidity, there is a weakness. And that's exactly what we want to focus on. Strengthening. And that's what ABR technique is specifically designed to do. Strengthening the deeper radial, sort of circumferential layers of muscles and fascia. Clearly, with this lack of the mobility, where everything moves as a unit, head, arms, trunk, legs, pelvis, and so on, it is impossible to expect any meaningful function of the hands, regardless of the intensity of the training. And the next component, the role of the hand in the suspended support of the body, and that's what you see here, that there is nothing, so the arm has no value in that perspective. The other dimension would be the use of the arm for the weight bearing. Again, we're seeing two things in the position on the stomach. No segmentation, like no selective movement of the arm, and respectively no weight bearing. His arms are not able to take the weight at all, but now I believe we understand, you can see for your own eyes why that is happening. Because the shoulder blades get depressed into his back and they slide up over his neck. Of course, in this case, he is not able to get a full weight transfer on them, no matter how hard he is trying all the way down over here. And of course, because of this, it's also impossible for him to lift his neck, because the neck gets into direct conflict with the shoulder blades. And then these are the further examples of lack of the usage of the arms for the support. Well, let's proceed to the analysis of the next stage in 6 months.